Well, welcome to this episode of TAC Tic Talk. We're joined in session with legend Dr. Lou Sportelli. I'm Joe Busch, your host, along with Jaclyn Touzard, publisher of the American Chiropractor magazine. We're very excited, so excited. We've already gotten into some conversations about the big, beautiful bill, the school coming online in the University of Pittsburgh, as well as this other program Dr. Sportelli was sharing about the program in Pennsylvania. Now, Dr. Sportelli, you're from Pennsylvania, right?
Yes.
So how much involvement did you have with these coming along?
The college program I had very little to do with that. Mike Schneider was really the lead on that particular
Mhm,
situation. He's done a marvelous job, and there's been two or three others that
mhm.
Tony DeLito and so forth have been involved with the college. I was involved substantially with the hospital accreditation preceptorship in
That
terms
sounds
of
awesome.
chiropractic residency program. Um,
Mhm.
and it was a it was almost it was necessary only because this particular facility here in Pennsylvania is a hospital that has it's a hospital network that has 16 hospitals now and about
Mhm.
50 outpatient facilities. So it's a pretty substantial network of hospitals, and they do everything right. They um, they under promise and over deliver,
There
and
you go.
they've been just a marvelous facility, and they basically took the issue, recognized that they did not provide chiropractic services in the hospital, decided that they were going to do that, and they did it absolutely with precision accuracy. So I am delighted that that's happening here. And is so when you look at where we are, the 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 profession is in an enviable position in a number of ways, and it's also in an unenviable position in terms of its challenges. Even, for example, I mean, just look, any time you're fighting a piece of legislation for 50 years,
Mhm.
Medicare, for example. I mean, we've been fighting Medicare for 50 years, and we now are. I mean, that's almost you've got to bang your head against the wall and say, "Wait a minute, how did that happen? 50 years?" Well,
Right.
when you finally realize that the Medicare, the initial bill, which I remember very well because I was actively in a state of disapproval. I did not like the idea that we were um, essentially approved for one specific service, and it defined us so limited that it was unbelievable. I knew that one day this was going to come back to haunt us, and of course, it's been haunting us for a long time. And he said, "Why is that Medicare bill so important?" Well, because now the Medicare reimbursement and the Medicare approval essentially has been adopted by almost every third party reimburser. So if you can't get reimbursed for even an E&M service under Medicare, how are you going to become included in an integrated setting where your billing uh, situation is so limited? I mean, the economics just don't work for organizations. You can't just deliver one simple service, and so it provided. It was almost as if somebody was attempting to provide this injustice to us, just the silliness of it all. If Joe, if you were a patient of mine and you were 64 years old and 364 days old, I can treat you to the statute of my law in my state. Now, the next day, when it's your birthday, I suddenly can't treat you for anything except the correction of a subluxation, period. I can't order x rays for you. I can't order any diagnostics. I can't bill for evaluation and management. I can't do anything. So, what does that do to the population? Incidentally, there are 10,000 people becoming 65 every day.
Wow.
Those
Mhm.
are
Right.
those are the people that are now in the process of having musculoskeletal and
Yeah,
ambulatory issues. So
they're the
the
most in need. Yeah.
very profession that can do the most good is the profession that's being denied access to that group of patients. I mean, it's an insane situation. The injustice is so
Well, so
clear.
so talk about that. It seems typical with what we've seen over the last 20 years, right?
Yeah,
Just with how the world has grown, and it's just kind of a counterculture. What's
yeah.
being done currently to really help improve that situation?
Well, this is the first time in a long time that there's a bill in Congress, both in the House and the Senate. They've got a fairly decent number of sponsors. If there ever was a time when Medicare could get passed, this is it. Um, However, I will tell you, I'm disappointed in the fact that the response from the general field practitioners has been less than stellar. I mean, what does it take get your phone and pick up and call your legislator, call your senator,
Mhm.
call your representative and say, "Will you sponsor this bill?" Because as I just said to you, the logic of the correction and the injustice of what it's doing to those that are being deprived of chiropractic services
Mhm.
um, is amazing. I mean, any most rational people would say, "Wait a minute, of course we can correct that." But what I'm
Mhm.
finding, Joe, is that, and I say this a lot of times, back when we were gaining, we got our last state of licensure in 1974. That's not too long ago. But
Mhm.
but I said then that the profession was mobilized. The DCs were enthused about accomplishing this objective of getting ourselves licensed in all 50 states. I say we could have filled Greyhound buses to march on our capital with our patients. Today, I'm saying we can't hardly fill a Volkswagen.
Yeah.
So, what's the difference? Well, the difference isn't because there's any lack of enthusiasm. The difference is because we're not organized as a group. And unfortunately, while this digital world we're in has made us in communication closer, but it's distanced us as a group. We don't
Mhm.
have to go to meetings anymore. I don't need to know you. I don't have to break bread with you. I don't have to know feel your passion. I don't have to do anything. I can sit and watch my phone and get my information. I don't have to do anything as a
Mhm.
group. And unfortunately, this legislative activity takes group activity, and
Mhm.
Right.
you can't hire a lobbyist to do the work that an absolute chiropractor can do when he or she calls their senator or representative.
Mhm.
Lou, what is the bill number? Do you know off the top of your head?
I don't know it off the top of my head, but it's
Well, we'll
on the
have to carry that
ACA
information on there.
website. It's
ACA
on
Right.
website.
it's on
Well,
the ACA website.
that's what I was thinking as I hear you, and I'm thinking, is there anything our listeners can do? I mean, when you tell me this stuff, Doc, there's nothing I love more than a challenge that hasn't been able to be resolved. I'm like, well, this is got to be something we get on the agenda. You know what I mean? I mean,
Mhm.
if that.
Absolutely, it is about as close as we've ever been to getting Medicare. And what I see, Joe, is I see that the general field does not recognize the significance of the Medicare bill being passed. It will
Mhm.
it will open up horizons
Mhm.
almost like the trial did.
Well,
Mhm.
so the attitude of the chiropractor in the field is to run the other way whenever you say Medicare. A certain amount of them.
Well,
They're like,
rightfully so. I mean,
yeah.
why would you want to participate in something that only recognized you for the correction of a
Mhm.
subluxation? Period.
Mhm.
I mean, it was an abominable piece of
Mhm.
legislation to begin with. But now, after 50 years, we realize, and of course, over the 50 years, Joe, back 50 years ago, Medicare wasn't such a big deal. But today, Medicare is almost the barometer for the
Sure.
rest of the reimbursement industry.
Mm-hmm.
It uses Medicare as its model.
Mm-hmm.
And so getting into Medicare is a big deal. I mean, it's not just nice to do, it's a big deal. And it also enables chiropractors to become involved in interdisciplinary clinics and associations and allow billable issues, which is the only way an organization can survive if you can bill appropriately.
Right.
So that's one aspect. If the other aspect, of course, is the injustice that has been provided to the millions of people over 65 who can't access a chiropractic service simply because of the silliness of a piece of legislation that was passed 50 years ago.
Well, that's a brilliant the way you pointed that out, Dr. Sportelli, quite frankly. Like, I never thought of it the way you're saying it when you say one day you could treat them with all the bells and whistles and everything necessary to help heal them. And the very next day, once they're now in over 65, sorry, it's not going to be
What
Medicare
does that
covered
do?
event.
What does that do, Joe? As the AMA tried to create this image of chiropractic and quackery and incompetence and so forth and so on. Well, I will tell you that the AMA sent a letter to Congress, hopefully denouncing and having the senators not participate in supporting the Medicare Act. So it's still going on, Joe. It's not.
Well, without a doubt.
They have that,
But
and everybody, and of course, that's a legal situation. While the lawsuit prevented illegal acts, there's nothing illegal about petitioning your legislature. So they have all the right to do that. So do we. But the bottom line is, they're still in 2025. They still haven't let go of denouncing chiropractic to the congressional delegations.
But Lou, that's totally consistent with the Make America Healthy Again approach, because this has been going on for 50 years. It's still going on today. They're fighting tooth and nail to prevent really patients from getting those conservative approaches that will help them avoid needless surgeries, medication. And that's why it's hard for me to understand why, even if you go to some of these leadership councils and whatnot, you'll hear conversations about how they don't want to support even these types of bills because it permits chiropractors to do maybe more than they're comfortable with other chiropractors doing, which is frustrating for me when I know that students are going through these programs, hundreds of thousands of dollars in debt, have to figure out how to be able to sustain themselves and a family, and they're limited to just one adjustment that might be able to reimburse $20. It's like less than a haircut anymore. I mean, it to me is tragic, and it's professional suicide to not try to advance bills like you're mentioning here, Lou.
Well, I just wanted to jump in because one of the reasons it sounds like this was a good time to dovetail that we even got on this call today or this recording was because I was coming across an old note way back when Contain and Eliminate was actually went to print. Was it around 2020 that you finally got this thing off the press?
Yep.
And so I thought, Doc, I'm sorry, we had a lot of other things happening in 2020. So I don't know if I've really ever given Contain and Eliminate enough press and coverage as it really deserves. So, of course, if we covered it, people did have a lot of other things on their mind. So,
well, yeah. And all the things they had on their mind, of course, is now proving to be probably the worst few years in our collective history, where the profession, where the world was destroyed. I mean, you could not go to church or not go to a gym, but you can go to Walmart,
right.
and
And
so
a liquor store.
the congregations. I mean, all of the things, all of the insanity that occurred as a result of that few years of essentially lockdown, and now we're starting to recognize the devastation that created in the human destruction. I mean, think about little kids who wore masks and their teachers wore masks, and
Mhm.
they didn't even recognize their teacher after a year in class because
Right.
they didn't know who they were.
Right.
And of course, the verbal situation and your basically your facial expressions are much more powerful than
Mhm.
the words we use, and so that was denied. And
Mhm.
so we have all of that. Now we're suffering
Mhm.
from the oppression and depression of the educational aspect of all those kids that were in school. I mean, nobody thinks
Right.
about that anymore. It's just crazy. I mean, it'll be another decade until
Right.
we really realize the total ramifications of what happened during that time.
Well, I mean, it
Well,
was an
and that
attack on the children, right? It was just like honestly, the student loan crisis, in my opinion. They just keep going after the youth, no matter where it is. But I mean, the United States got hit as hard as anywhere. Jaclyn, you
well,
have kids. You saw how that changed
I was gonna
them
say I
during
wanted
that
to
time.
jump in because Dr. Sportelli, I tend to be the optimist of everything, and I always tell Dr. Joe, I always like to believe everyone's doing the greatest good, for their constituents and politics and everything. At the same time, when we talk about the Medicare issue, where it's established that the oldest generation is the least cared for in Medicare, you know what I mean? Where the conservative care is actually being blocked out for more invasive care and dangerous care with drugs and surgery. I mean, that would make sense. And then even now when you talk about the children, I remember you, Dr. Sportelli, I love it every now and then when I get on your book club and you sent me a great book, Lost Connections, which
Yep.
is exactly about this depression thing. And when you talk about what happens with our kids, holy cow, I hate to say a nervous wreck, but a lot of the kids are much more stressed than they've ever been. And Lord knows I've had to witness my kids growing up for a couple of years in major lockdown with masks on. It's one thing in the States when you're out in the rural society. We live right in the heart of a city here where I'm at, and I'm telling you, we got to live lockdown at least 1 year online schooling, and then the year after that was with masks in the classrooms. It's devastating, devastating. And so that's why I'm glad, like, here we are in 2025. And I thought, holy cow, I'm coming across these notes, contain and eliminate. You and I got talking up yesterday, and you were telling me too about the different things. And this kind of leads in even to what you do with the foundation. So I was going to say, I don't want to usurp, if you wanted to go on more about contain and eliminate, because that's always a good
Well,
foundation to lead into.
sometimes there was an old speaker from the platform, and his comment was never tell a joke without tell never tell a story without having a meaning, and never say anything unless you have a reason to say it. And it's those stories sometimes that it's the stories that never leave you. I mean, I can deluge you with facts and it'll be okay,
Mhm.
but a story. And here something, uh, Joe, that strikes me to the core relative to the Medicare issue. Back in the '80s, we did a story, a publication. The editor of the ACA Journal and I toured nursing homes. And I'm going to tell you, I still to this day remember that and remember the impact. And as we went into those nursing homes, okay, the bottom line was the people in the nursing homes were not afraid of dying as much as they were afraid of the loss of dignity.
Mm.
Now, and so as I pressed, what do you mean by that? Well, they couldn't comb their hair or bathe or put lipstick on or dress themselves or well, those are the things that they were afraid of losing, that loss of dignity. And as I thought about it, I said, these are the things. That's why I used to love to take care of senior citizens. And of
Mhm.
course, I did it in the '60s when there was no reimbursement for anything, so they paid themselves. But when you take care of seniors, you just need a little incremental improvement, and it's amazing what it does to the senior citizen. And here we are now fighting that very issue all over again. I wish our DCs around the country would recognize that enabling Medicare change would open up a horizon and vistas for millions of senior citizens to restore their dignity, allowing them to be ambulatory, allowing them to put lipstick on in the morning, allowing them to comb their hair, all of those things that we take for granted that are absolutely essential to be human. And that's one of the reasons, one of the passions that I think is just amazing to me, that we ought to be jumping on this thing for nothing else than to eradicate that problem that 10,000 people every day turning 65 will be confronted with.
Excellent point. Definitely. That needs to have a spotlight on it, and we'll be sure to do that following this in a future issue. So I'm planning on definitely we're going to add that to our agenda. So just kind of building on that Contain and Eliminate book, we talked a little bit earlier, but you mentioned that you had worked on that for an extended period of time with George McAndrews before his passing 2 years ago.
Yep.
And then how that kind of set the stage for the usurpation of chiropractic and even Medicare. How did that history, influence the next 40 years? Because now it's almost 40 years ago, right?
Well, it's 1992, yeah. So it's been a while since. What happened was
It's a big number.
what happened was the fact that once the lawsuit was won, I mean, there really was a universal influence. There was no question about it. What the thing that really was kind of interesting, funny, and brilliant, as far as I'm concerned, is when George McAndrews petitioned the court the second time, because we lost the first lawsuit. We lost the first one only because the AMA wanted to put chiropractic on trial. They wanted to. They drug out every insane advertisement that any chiropractor ever published. They drug out everything that you could so that the jury would see that chiropractors really, they were protecting the public's safety. That was their theme. Well, when we lost the first case, George decided that the second case ought to be a bench trial. And the reason that was important is because the trial really had nothing to do with chiropractic. It had to do with the conspiracy and the unlawful activity of trying to eliminate and contain a profession that was licensed. That's illegal. They designed an economic boycott to make chiropractic suffer and essentially go out of business. The judge saw through that. And one of the things that was one of the biggest bones of contention in that case was the fact that one of the requests of McAndrews was that this her findings be published in the Journal of the American Medical Association, in JAMA. They fought that tooth and nail. It was almost like, we don't want this exposed. And when it finally was published, Joe, I can tell you that we got letters. I mean, the ACA got letters and so forth from medical physicians all over the country saying, I'm embarrassed about what my profession did, and I'm going to open up my radiology facility. I will open up my laboratory facility. I mean, it was like they recognized that what they had done, and it was done without their knowledge, and it was done. They were participating in this thing and really didn't have any idea what was happening. And so many of them really felt that this was an injustice and opened up, and it changed the whole climate. So once that happened, then and the pressure was off and of course, remember now that early on they called us quacks. It was a brilliant strategy to denigrate us. So, but they also said we were uneducated, and so therefore they planted that seed of incompetence in the minds of the public. Well, interestingly enough, when the lawsuit and discovery happened, it was kind of almost ironic that the chiropractic colleges that were looking to employ medical physicians and PhDs for their faculty in order to upgrade the whole educational experience. Well, those people got letters from the AMA saying if you teach at that chiropractic college, you'll never teach again. Well, now you can't call us stupid and then prevent us from being educated. But that's exactly what they did. I mean, it was a self-fulfilling prophecy that they executed this particular activity with absolute precision. I mean, it was unbelievable. It was a SWAT team essentially, and they executed it wonderfully. And you got to give credit to the brilliance of the program, but you also have to look and see how destructive and Machiavellian that was. And
Right.
once exposed, of course, sunlight is the best disinfectant. And
But
so
we're
once
still paying the price there. I mean, though, with the Medicare.
things changed. So I basically, I will send you a document after we're done here that about the early HEW, that's Health Education and Welfare, which is now HHS, about how the AMA literally fixed that particular meeting, and it was unlawful, it was illegal, and yet it was effective. It was what they accomplished at the time. And again, go back, and I always I do this all the time, Joe, because you can get very warped with your thought process, and that is that there is a huge difference between political medicine and clinical medicine. The clinical guys care just as much for their patients, and they want to do the right thing.
All right.
And so you can't just lump medicine under one umbrella. You got to divide the political Machiavellian mindset
Right.
for politics, and because the vast majority, and as every year goes by, we get further and further away. And I say this, and I get chastised for it all the time, but we advance one funeral at a time.
Right.
And so
Well,
every year,
their political biases have influenced the educational
a-
bias too, though.
absolutely,
So
absolutely. But I also, and then you say, well, how does what happened? What's the effect? When you think about this, Joe, you can't look. You can't be born without a medic, and you can't die without a medic, and you need one every place in between. So,
right.
do they represent a influence on the way society thinks? Of course they do. They're not only in medicine, but they're almost in every other branch of every other organization, whether they're in healthcare or whether they're in politics or whether they're in government. The bottom line is the medical profession has placed themselves in a position of incredible authority without essentially ever being elected.
Right. Well,
So
worldwide. I mean, worldwide, because it's not
yeah,
only in the United States. If you go international, it's much more severe. I mean, like
yeah,
honestly,
we've
it's all
we've
they call
given,
it
and
a medical dictatorship.
yep, yep. And it's and of course it's getting to the point now where that power shift is really shifting radically. The medics have essentially lost their collective power, and it's been shifted to big pharma. That's where the
Right.
power is today,
The
because
money. Yeah.
if you go anytime you go into any issue and you have a issue confronting you, ask yourself, follow the money, and if you
Yeah.
follow the money, you'll usually come to the right ideas of what's happening in reality.
Well, I'm really glad we got you on today because it's very important that we have this historic document, Lou, that you did with George McAndrews about the history. Because, a lot of people don't even recognize 50 years ago, they think is so far away, but how it shaped what we're living today. I mean, this is the reality. And now we're walking into this big, beautiful bill that we were chatting about just a minute ago, and how that is influencing the schools now, right? So not just the chiropractic schools, all the schools. Hopefully, it's going to help students protect them and have families down the line, right? But what's your sense of how that's going to influence the
Well,
chiropractic profession?
out of every adversity comes an opportunity. I don't
A
ever
great point.
believe that that's not the case. So
Right.
what'll happen is like happens all the time. There'll be a collective discussion, and there'll be a decision on, okay, here's our issues. How do we confront them? I mean, there was it's from every event that's occurred, Joe. There has been a challenge. I mean, when the initial automobile, oh my God, what's that gonna do? Well, it overtook the horses, and so then we had agriculture, and then we had the industrial age, and so now we're in a digital age, and so. But every time there's been an adaptation of what's going to happen. So the colleges are going to have to collectively look and say, okay, how do we do what society is doing, and that is to number one, provide the best kind of education we can provide, and reduce some of the unnecessary times. There's a lot of stuff that you just don't need to become a good practitioner, and
Right.
they're going to have to accept the fact that if they're going to compete in a competitive world of people deciding on what kind of careers. Do I want to be a chiropractor? Do I want to be an optometrist? Do I want to be a medical physician? Do I want to whatever the case may be? There's always that. Okay, here's the positives, and here's the negatives, and they're going to have to. The colleges will. I have no doubt about the fact that they will devise and design a system that will
Mhm.
enable them to compete in the collective world of chiropractic education.
Well,
So,
and Dr. Sportelli, if I may jump in, because what you're mentioning there, they had at a leadership summit meeting, gosh, I think about just a year ago, where there was a big presentation about the cost to become, I want to say maybe like a physical therapist or a PA or a
yeah,
physician's assistant. Is that the right one? That compared
yep,
to what the costs were to become a chiropractor.
yep.
And they had everybody up in arms, and suddenly it was like, so the big question is like, you know, what's the solution? Is there foundation on this? Or is it all a bunch of fear mongering? It was almost
No,
like,
but here's the difference, Jackie. Here's the difference. Um, you can even go back as short as 20 years ago. But if you go
mhm,
back longer, 30, 40, 50, 60 years ago, everybody went into chiropractic college as a career,
mhm,
went as a choice. They had an experience with a chiropractor. It was either their parents or their colleague or their chiropractor. They had some connection to chiropractic. It was
right,
a it was a calling. I
mhm,
want to. I want to. I like what chiropractic does. It did something for me. I want to become a chiropractor. It was a calling. You
mhm,
you fast forward today, it's the calling percentage is really pretty small. It's now the
mhm,
selection of a career, and which
right,
is okay. There's nothing wrong with being
mhm,
saying, okay, I want to be a chiropractor. I'm going to look at all the careers. I'm going to look at chiropractic. I'm going to look at physical
mhm,
therapy. I'm going to look at physician's assistants. I'm going to look at nurse practitioners. I'm going to look at medical physicians. I'm going to make a choice, and then that
mm,
choice is predicated upon length of time, it's a return on your investment, all of those
mhm,
kinds of things, which never influenced the chiropractors many years ago. They went into chiropractic simply because there was no other way that I was going to survive or exist unless I became a chiropractor. I mean, there's a big
mhm,
difference, and not disparaging of the fact that that's the case. It's just a very different model. I mean, it's
mhm,
just
Right.
a different model. And if you ask
mhm,
the students in chiropractic college today, how many of them had personal experience? I think you'll probably find a small percentage. And the ones that elected and selected chiropractic, they did it as an elective career. Not
Right.
mhm,
the calling piece isn't there. And I don't know that that's any different in medicine today. I mean,
mhm,
most, and matter of fact, there's a transition in medicine which we don't recognize very often. But we got about 85% of the medical physicians today are employees of
mhm,
healthcare facilities. So
right,
they've also lost that kind of entrepreneurial mindset where they were their own practitioners. They
Mhm.
worked for themselves. They built their own practices. They had, they had established recognition in their communities. Today they're doing a different kind of job, a good job, but
Mhm.
they're employees. So,
Mhm.
uh, so so there's a very big difference in the way in which everybody responds uh, uh, to either a calling or a job.
Right. Well, and I know we're getting close to your 1 hour mark. So I wanted to make sure one area that I wanted to hear a little bit more from you that we haven't yet has been your work now, of course, with NCMIC and the foundation and the research work that you're doing. Because you'd mentioned yesterday something really great where you talked
Yeah.
about the the arms that you used to use in the past, which was legislation and litigation. And
And
now,
now
what's the weapon you're
today
using
the weapon is research, and I remember what I said to you, and I pull out something that is just interesting. There's an article in the International Journal of Environmental Research and Public Health. It's called "Spinal Pain: Chronic Health Conditions and Health Behaviors." Data from 2016 to 2019 National Health Interview Survey, and all four chronic health conditions significantly increase the prevalence and odds of spinal pain,
now?
cardiovascular disease, hypertension, diabetes, and obesity. Now, I want to tell you, obviously, I'm an old time practitioner. I've been practicing for 1962. So I saw patients come into my office that that had all of those conditions, and but they came in for something else, and
Mhm.
we didn't have either the wherewithal or the money or the thought process. I mean, hell, in some states we weren't even licensed to be thinking about, can chiropractic really influence those
Mhm.
comorbidities that we're seeing today? And
Mhm.
now, 50 years later, we're starting to get researchers to be looking at the spinal component of those comorbidities.
Mhm.
Nothing makes me happier than to see all of this start to take place. And we have the issues of neuroplasticity. Well, we never thought that was occurring. And now, what are we doing really with an adjustment? And now we're starting to find out that we're doing a hell of a lot more than we thought. We're just,
Mhm.
it's not the bone out of place anymore. It's really
Right.
understanding the neurology, understanding the things that are now starting to emerge. Now, this is really, really, really early, and that's why I'm so focused on the research aspect, because this is what's going to essentially transform the
Mhm.
entire concept of what chiropractic is going to be the
Mhm.
research of the future. So
Mhm.
what we do at the foundation is we have many applicants who are DCs who want to become PhDs. They come to the foundation for some help and support. I think we've done, if my memory serves me right, it could be 50 or 52 so far. We fund some of these DCs that have gone through Harvard and Yale. We fund research projects, small mini project, because nobody, you can't get any you can't get any grants from NIH anymore unless you've got a small pilot project. Well, the small
Mhm.
pilot projects cost a lot of money, so NCMIC has been able to fund quite a few small pilot projects to allow the researchers to apply to NIH for funding based upon a small sampling, and that's a big factor today. And
Mhm.
thankfully, we've got some phenomenal researchers. I mean, to name them would take a whole program, but honestly, this is where tomorrow is. Tomorrow is,
Mhm.
talking about the future is. I mean, it's almost mind boggling. I
Mhm.
personally have a difficulty. I pinch myself on a regular basis because I never
Mhm.
thought that I would be able to see the total transformation of what's happening within the framework of the profession.
Mhm. Well, and you'd mentioned one last thing too after, dovetailing about contain and eliminate, and you mentioned about with RFK and what's been happening, with what you're seeing politically.
Oh yeah.
kind of like
Well,
a repeat.
the
So
big
tell us the
pharma.
game plan you're observing.
Well, there's been it's the same old playbook. The big pharma, from what I'm reading from some of the news releases from those on the inside, are saying that big pharma has allocated several $1 million to get rid of RFK,
Mhm,
because he's a danger to their profitability and pocketbook. I mean, there's no question about the fact that big pharma, for the first time, has now been on the spotlight or
mhm,
recognizing that. And you can't take anything away from the incredible technology. Just the other day, at
mhm.
Baylor University, a surgeon operated and replaced an entire heart through two small incisions next to the navel, was able to do it robotically, take the old heart out, put a new heart in. Think about that. Now that
That's
Wow.
makes
crazy.
that makes headlines, and it makes medicine as
Mhm,
if it were omnipotent and from outer
mhm,
space. Bottom line,
Right.
but the fact of
mhm.
the matter is that's not medicine. That's technology. That's
Yeah.
advancement in technology. We haven't. We can transplant a heart without opening a chest, but we're no closer to the common cold than we were 100 years ago. So we got
That's
to make
Right.
sure that we put the focus on what it is. And unfortunately, medicine has played this thing brilliantly, and that's why people look at medicine with such awe and such inspiration,
reverence.
because they take medicine and they don't
Mhm,
think about the fact that with every one of these pills for
mhm,
every ill, there's
mhm,
a a response, a
mhm.
negative side effect of every one of those. That we don't talk
Right.
about that as much as we talk about the sensations of this
Mhm.
marvelous things that we're doing in technology with the Da Vinci
Mhm.
procedures and all of the AI and
Right.
everything else that's involved. So,
Well,
you got to kind of balance it. You have to give credit where credit's due, but when you
totally.
when you really peel the onion back,
Yeah.
the fundamentals of medicine in terms of the
Yep.
everyday common ailments, and especially in terms of spinal ailments,
Right.
there really isn't much.
Well, and I almost wanted to say because I never like to even think big pharma thinks that we don't. Hey, I love painkillers when I'm in pain. Big pharma's my best friend. I mean, I'm
Jaclyn,
telling
big pharma. No, Jaclyn, just the
but
pharmaceutical might be your friend at that time.
anyway, but I wanted to say because I know sometimes when you mention even about for chiropractors, the whole prevention, an ounce of prevention worth a pound of cure. To me, that's what chiropractic is in its greatest thing, and it's not as sexy. Nobody likes as much, and it's cool to be an MD and come in and be able to do these life-saving surgeries. But imagine with your patient base how many lives you're saving so they actually can enjoy it, getting people out of pain so they're a nice human being. I mean, that's amazing.
Well,
So
they can be functional and they aren't relying on other people because a lot of those surgeries, even with high technology, doesn't necessarily mean it's going to be successful surgery. It just means they were able
yeah,
to do that. But the
and
long
it
term
does
implications,
another one. More oftentimes than not, they need other ones because there's always underlying factors. So that's where our goal is to working together.
Joe, I also say, thankfully, as being a chiropractor, and that is that more and more of the care for individuals um, is distant. The physician, you go into a physician, they hardly look at you anymore. They're looking at the iPad. Matter of fact, there was a Dr. Andrew Vergi did a YouTube presentation. He calls it the eye patient. Why?
Mhm.
mhm,
Because they're looking at their iPhone or their iPad, but they're not looking at the patient. And I think
right,
that chiropractic is one of the, thankfully, we still have the touch aspect, and
Mhm.
thankfully, we still haven't forgotten the human aspect. And I'm going to tell you,
Mhm.
mhm,
there's a lot of new stuff coming out showing that when a patient feels heard and feels understood and feels seen and and has information from their practitioner, their response is totally different. And that's what
Mhm.
chiropractors did without all.
Mhm.
When I joke, I didn't know how to spell biopsychosocial. When I first started in practice, but that whole aspect of now we're bringing care back into this understanding of the
Mhm.
patient,
Right.
making sure that they know. And I think chiropractors do that absolutely marvelously, and they don't even think about it because that's what we do every day.
It's magical, especially a lot of people who are at that age, they don't touch people. People don't touch them anymore. With the 65 I'm talking about, it's they hug their kids perhaps when they come by, but it's not as frequent. And it is magical if you see it in a clinic. So what you're saying, that's why I think that chiropractic would be so hard to supplant for AI and whatnot. You just can't replicate that.
We're now 130 years old as a profession, and we've
Mhm.
survived the most incredible things to destroy us, and we're still here. And why is that? I think I absolutely think it's because of the connection to the
Mhm.
patient, that
Mhm.
feeling of being heard, touched, felt, understood. And I think
Mhm.
that's what chiropractors do. Unconsciously, they do it, and
Mhm.
I think that's what's enabled us to continue to survive.
Mhm.
Thankfully,
Very good. On that note, I think no one could have said it better. Dr. Lou Sportelli, thank you for your time very much. Look for this a transcribed interview in an upcoming issue of the American Chiropractor. And I look forward to seeing you around, Dr. Sportelli. Are you going to be around at some seminars in this year?
no, I'm Joe. I'm not traveling. I'm
All
basically
right.
just I'm just
I'll keep
enjoying.
looking forward to it.
I'm